injury provokes an acute inflammatory response with neutrophils and macrophages. The macrophages mop up debris and try to neutralise any bacteria. But if the agent causing tissue damage can't be eliminated rapidly, macrophages then prime the body's immune system, provoking a response which is specific to the antigens involved. The immune response is often recognised microscopically as chronic inflammation and is mediated by T and B lymphocytes. This is the nucleus of a lymphocyte. It is round and stains darkly because it has condensed chromatin. This thin film of cytoplasm is all that most lymphocytes have. These cells are also lymphocytes. We can't tell whether they are T lymphocytes or B lymphocytes just by looking at them. This requires special techniques. Immunoperoxidase labelling with a T cell marker labels the T antigens on the cell membranes. Other cells are negative. Similarly, B cells can be labelled and appear brown. While other cells are negative. This is the nucleus of a plasma cell. It is also round, but the chromatin is arranged in blobs round the edge, just below the nuclear membrane. The cytoplasm is basophilic because it contains lots of RNA, busily synthesizing immunoglobulin. Plasma cells are B cells. This clear zone is the site of the Golgi apparatus. Usually the nucleus is perched at one end of the cell. So plasma cells are easy to recognise. Immunoperoxidase labelling shows immunoglobulin M in the cytoplasm, here stained brown. We can demonstrate immunoglobulins G and A in the same way. This is gastric mucosa from a biopsy from the stomach. Here are antral glands. They are separated by an infiltrate of cells. From the lobed nuclei, we can recognise these cells as neutrophil polymorphs. There is therefore acute inflammation. In addition, however, we see lymphocytes and plasma cells, indicating an immune response. This is an acute or active chronic gastritis. Both acute and chronic inflammation are present. Turning to the liver, these are normal hepatocytes. But in this liver, the hepatocytes, such as this one, are swollen. They have been injured by infection with virus. Here are lymphocytes, each with its single, round, dark nucleus. And a plasma cell, with its more abundant cytoplasm. These cells, with pale nuclei, are macrophages. The macrophages have primed the immune response, which is trying to destroy the virus. This is chronic active hepatitis. If the virus can't be destroyed, the inflammation persists. These hepatocytes are swollen. They have been injured either by the virus itself or by cytotoxic T lymphocytes of the chronic inflammatory response. The blotchy red rash on this patient's skin is a dermatitis reaction, many patterns of which share the same microscopic features. Here's the keratin, the rest of the epidermis, and the dermis containing small dark nuclei. We're going to look at this area more closely. These are lymphocytes among the epidermal cells. And spaces due to edema. In the dermis, a chronic inflammatory infiltrate is prominent in dermatitis. It is often around blood vessels, such as here and here. The infiltrate includes lymphocytes, usually T cells. And macrophages, which are larger. They present antigens to the T cells and often phagocytose material. In many types of chronic inflammation, macrophages are unable to destroy the causative agent. The macrophage may then develop an elongated pale nucleus and eosinophilic cytoplasm. Such a macrophage is called an epithelioid cell. It attempts to sequester the toxic agent by becoming less motile and less phagocytic and developing a secretory function. A collection of epithelioid cells is a granuloma. Epithelioid cells may fuse together to form a multinucleate giant cell with numerous nuclei in the same cell. Here's another giant cell with numerous nuclei just below the cell membrane. These are epithelioid macrophages. And a giant cell. By passing polarized light through the tissue, we can see that the cells contain foreign material. It appears bright because it rotates the plane of polarization. In this case, it is catgut from a surgical suture. This is a foreign body granuloma. By fusing to form giant cells, such as here and here, macrophages can sequester large pieces of foreign material which they can't break down. Sometimes the immune response itself has harmful effects. It may react against the body's own tissues, autoimmunity, or it may react excessively to the antigen, hypersensitivity. Such reactions are often manifest as chronic inflammation. This is normal thyroid gland. This pink namely thyroglobulin. Each follicle is lined by cuboidal epithelium. This thyroid, by contrast, looks very different. Here are some thyroid follicles containing pink staining thyroglobulin. But the follicles are small. Between the follicles is an infiltrate of cells. Here are lymphocytes. And plasma cells. This is a chronic inflammatory infiltrate. Note the lymphoid follicles, each with a pale germinal centre. Lymphoid follicles may form when inflammation is intense. This is Hashimoto's thyroiditis, which is an autoimmune disease. Plasma cells manufacture antibodies to thyroglobulin, and the chronic inflammation destroys the thyroid gland, so the patient becomes hypothyroid. A second disease where the immune response has destructive effects is tuberculosis. In tuberculosis, the macrophages ingest the tubercle bacilli. Seen here stained red. The macrophages can't destroy them and become epithelioid. With particularly big multinucleate cells, called Langham's giant cells. However, the body's T lymphocytes react excessively to the protein in the bacteria. This hypersensitivity reaction causes much tissue damage. As a result, a tuberculous granuloma, outlined here, often has central necrosis. It is called caseous necrosis and reflects severe tissue damage due to the violent hypersensitivity reaction. This chest X-ray shows numerous white spots in the lungs. These are granulomas. In this case, they are due to tuberculosis, but granulomas occur in many chronic inflammatory diseases. The inflammatory reaction is accompanied and followed by a healing process in which the body tries to repair itself. If the agent which caused the tissue damage can't be eliminated rapidly, inflammation and healing may go on side by side for many years.